The program also provides, tries to provide social protection by trying to make up for the out-of-pocket expenditure that a patient may encounter due to the cost for diagnosis or for treatment or for traveling and coming and going to the health facility for taking treatment, and also incentivizing him for notification or providing nutritional support, and also to try to compensate for any loss of wages. So the program, and not only from the program but also the state initiatives and various district level initiatives are under various other national programs or under various other departments, like from the social welfare department or from the women and child department. There are various schemes for which the patient is linked to, so that various issues can be addressed, and these and the financial incentives, like I said, is going to be transferred directly into the beneficiaries account through the DBT mechanism, so that transparency is also ensured and the patient is able to receive that money directly. All these efforts are basically to provide universal access to all TB patients, including the private sector, for drugs and diagnostics, and the various costs that is involved, the cost for diagnosis or for treatment is taken care of. The program, the DBT which I just spoke of, the incentives that are available under the program for the TB patients or for the treatment supporters or for the private practitioner for notifying or ensuring treatment compliance. These are provided through the system software that we have for the program, which is called as NPTEL-NOC. The NPTEL is linked to Aadhaar and also linked to the bank account of the patient and the public financial management system that is for the financial management system for the government. The NPTEL software is linked to all these three aspects, and what is called as JAN, Jan Dhan Yojana, is basically the account of the patient, Aadhaar and NPTEL. This triad is what is used for providing, and the systems have been built to provide seamless transfer of money from the government to the patient's account directly. And the government of India has also issued the gazette to ensure that Aadhaar is mandatorily entered in for providing these cash benefits. Aadhaar is linked, and also for notification of TB patients in NPTEL, the information of Aadhaar is collected and entered into NPTEL. The private sector is a big challenge that we have in this country. The health seeking behavior that we have in our country, almost 60 to 70% of the patients seek the primary care at least for the first time in the private setting in India, and this has resulted in a huge number of TB patients who are probably taking treatment in the private sector but are not getting reported under the program, and because they are not reported, the program doesn't know those patients. The program is unable to provide the ancillary services and the social protection measures or the support public health measures that is required for a TB patient. So the program has proactively developed mechanisms and systems to engage with the private sector, and the initial concept of passive of any private practitioner coming to the program is now changed to a very active mode, where the program is actively going and engaging with the private sector. There are standards for TB care in India that has been published by the government. So the treatment protocols, the diagnostic protocols, everything is available, and standardized drugs, WHO pre-qualified quality assured drugs are available under the program, and the private sector is provided all these support free of cost. So the patient seeking care in the private sector can also have access to free drugs and diagnostics, and also the the society can be benefited by the public health measures and the social protection measures that are available under the program for the patient. The government has made notification of tuberculosis as a mandatory procedure, and the private sector, even if tuberculosis, any medical officer is diagnosing tuberculosis in the private sector, he or she should notify that case and to the public health department. The program has developed formats so that the patient or the provider in the private sector also can notify tuberculosis very easily. He can even just send an SMS or a WhatsApp message or emails, or just give the information to the nearest healthcare worker by over the phone, and these systems, whatever information that is collected, is then entered into NPTEL, which is the software for MIS tool that we have under the program. All the activities and the services that are provided for tuberculosis, right from diagnosis to treatment to adherence to follow up, everything is covered under these and is covered and linked into NPTEL. The newer diagnostic tools like CBNAT that is available is also linked to NPTEL, and the CBNAT information is directly available, and the message and the results, everything can go seamlessly from the and patient based information is available in this system. The program has proactively taken certain initiatives to engage with the private sector. There are very good pilot models that the program has demonstrated. It's called the public-private support agency, and various schemes that are available for, it's called the PPM schemes or the partnership schemes, where the private sector can be engaged, and the district and the supervisors that we have at the block level are the ones who reach out to the private practitioner and offer him all the schemes that are available through this. I'll just highlight on a couple of pilots that we did, pilot models on private sector interventions using the public-private support agency, where an NGO was identified to actively go and reach out to the private sector and provide free drugs and diagnostics or subsidized drugs to the private sector. And these models, where these pilots were done in parts of Patna, in Mehsana and in Mumbai, and you could see that the notification of cases almost doubled in Mehsana and in Mumbai, whereas in Patna we could the numbers increased more than 3 times. So these models are now being scaled up to the entire country based on case scenarios, different scenarios in different districts. Also the efforts that the program has taken to reach out to the pharmacies and the drugs and the chemists and monitor the Schedule H1 drugs, and since RNTCP, the tuberculosis, anti-tuberculosis drugs are all Schedule H1 drugs, and it is to be mandatorily maintained by the pharmacist. The name of the copy of the prescription and the patient details are expected to be maintained by the private pharmacies. So the program has started monitoring and utilizing this information to identify the private practitioner or the patient and reach out and provide them the various services like and incentives that are financial support or social welfare support that is required for that patient. So these were various efforts of private sector engagement has in the national level, year on year over the last 3 years, the number of cases notified has increased from 1 lakh in the private sector to almost 3 lakhs, 2 lakhs and 3 lakhs in the subsequent years. So in the last year we had more than 3.5 lakh tuberculosis cases notified by the private sector. So to summarize in this session, I would like to stress upon that the TB is tuberculosis is a curable disease, and The program is providing free drugs and diagnosis. The most important thing is that the patient has to complete the duration of treatment and ensure adherence to that and to the drug regimen. Various IT tools are available to support patient. There are standardized diagnostic algorithms and treatment protocols that are made available, and these are all following all guidelines that are prescribed by the WHO, and it ensures that the services that are provided are of quality assured services. The information of tuberculosis, notifying that to the public health system is mandatory. This message has to be reinforced to the private sector, and so it is essential that you take back this message and you remember that notification of TB is a mandatory activity in this country. The program also provides support for addressing all the other requirements for a tuberculosis patient, like the social protection measures that would be required for nutrition or housing, etc. All these things are also important, and TB providing free diagnosis and treatment is not going to help us eliminate this infection in the country. The tuberculosis can be addressed only when all the social determinants are addressed, and hence it requires a multi-sectoral approach. So with these messages, I am sure you would have learnt the basics of tuberculosis diagnosis and the various treatment regimes and services available under this program. Thank you very much.